So start with already permission. We are beginning with the session for today. Good afternoon, everyone. This is Madhu from IGCP, moderator for today's session. I would like to welcome everyone who participated in our platform for the great exchange of knowledge that is going to be shared by our renowned ophthalmologist, who is none other than Professor Dr. Mohan Rajan. Sir is MBBS, PhD in ophthalmology, Geo, FNRF, MCH, HCA, FIAS, FRCS, PhD, BSc Chairman, and MD of Rajan Eye Care Hospital Clinic. With such wonderful insights, we will talk about the topic for today, which is ocular trauma Panorama. Before moving on to the segment, let's have a brief look about the topic. So, ocular trauma refers to injuries affecting the eye and its surrounding structure, which can result from accidents, stroke, or work-related vision. These injuries can range from minor abrasions to severe damage affecting vision. Plot assessment and treatment are crucial to prevent long-term complications and preserve vision. In this wonderful webinar, we are going to learn about the topic for today. And now, without any further delay, I would like to welcome Sir Adam Asura. I would like to hand over the session to him for his gracious talk to begin. So, over to you.
Thank you very much, and very good afternoon to each and everybody here who are attending this webinar. And this IJCB webinar is not new to me. I've done this probably the third or fourth time I'm associated with them, and it's a real pleasure to be here. I'm actually speaking from Dubai, where I'm here for a meeting, and these are my financial interests. And are you able to hear me? Are you able to hear me? Hello?
Yes, sir. Please continue. You're audible.
Very audible? Okay, fine.
Yes,
okay.
yes.
Any problem, let me know. Every
Sure,
5
sir,
seconds,
sure.
every 5 seconds, one person in our world goes blind, and a child goes blind every minute. Why are we bothered about blindness? Because this curable blindness is something which is 80% of the blindness can be completely cured or reversed, or even to a certain extent avoided. Okay, it's called needless blindness. For example, cataract, glaucoma, corneal opacity, short sight, long sight, diabetic retinopathy, and of course, ocular injuries, which we are going to talk about today. So all these, I think we last webinar and sometime in November, I covered about what is the latest in cataract surgery in diabetic retinopathy. Today, our focus is going to be on ocular trauma, and that is why I named it as an ocular trauma panorama. Why we need to know about the economic burden of blindness? Because there is an average number of working years lost due to adult blindness is about 10 years, and a child becomes blind, the loss of 33 working years. The child becomes a burden to the community, the burden to the family, and burden to the government. So why I'm talking about children blindness is because injuries, ocular injuries, are more common in the younger age group. I'll be talking about it during the course of my talk. As you know, the eyeball structure is like this. There is an object in front of the eye which gets refracted through the cornea and then through the lens and goes to the center of the retina, which is called the macula, and center of the macula is called the fovea. From there, through the optic nerve, it goes to the back of the brain, which is called the visual cortex. So this is called the visual cortex, and from the visual cortex, the brain signals are being sent to the eye. So if there is any problem in any of this visual pathway system, the blindness can occur and the patient will not be able to see. So the blunt impact, the injuries of the which can occur either because of the blunt injury or by means of a sharp instrument, which is called a penetrating or a perforating injury. It can occur to the front of the eye, which is called the anterior segment, or to the back of the eye, which is the retina and optic nerve, which is called the posterior segment. Now, what are the different types of ocular injuries you can see? Starting from corneal abrasion, hyphema means blood in the anterior chamber, iridodialysis means wherein the pupil gets torn, and traumatic cataract, as you all know, cataract, because of injury, the cataract occurs. Tear in the cornea, rupture of the globe becomes completely into two halves. So all these problems can occur because of this. Now, let us talk about domestic violence, which is becoming very common in our country, like India, especially after the COVID. Is because domestic violence we are seeing more responsible for the severe ocular injuries, causing irreversible blindness or even death in some cases. Very small number of women dare to report against their spouses. Usually, it is the alcoholic husbands or husbands who are not having any job or anything. They assault the women, and because of that, the injuries occur in the eye. If you look at the global, what you call scenario as far as the domestic violence is concerned, India is the largest. You can see that almost close to about 40%, followed by the East Mediterranean region and then Africa as well. And it's because of this, the domestic violence is a very, very important cause of ocular trauma. And if we take India, the Uttar Pradesh recorded the highest number of complaints in the domestic violence, followed by Delhi and Maharashtra, and then we have Bihar, Madhya Pradesh, Haryana, and other states will follow. But this is a very, very serious problem which are occurring in the country. Domestic violence can occur because of the problem in the family, or problem in the family because of the property dispute, family dispute, and so many other things can occur because of the domestic violence. So prevalence of domestic violence in India is about 3.5%. Domestic injuries may be around 15% among this trauma. So mechanism can be either blunt, as I told you, or penetrating with the sharp objects. Specific objects may be used, resulting in patterned operations. Chemical injuries like throwing acid and alkali, which I'm also going to show later, is going to can happen. So these are the various this thing wherein the domestic violence is a fist injury, or using a sickle, or using a hammer, or using a knife, and all these, or throwing acid or alkali, or what you call usually it's an acid injury, acid victor it's called, on the face, on the eyes, and so on. All these can occur. And this is when you have a domestic injury. This is a flow chart, which is not of very significance in this webinar. But why? When should domestic violence be suspected? It's more common in females. History of recurrent traumatic manifestations, trauma on the dominant side, high suspicion in case of orbital fracture or ocular injuries. If there is a mismatch of explanation of injury by the victim with the nature of injury, as a doctor must be alert to pick it up and report, and probably suspect, because many of the females don't report that their husbands assaulted them, or there can be even because for fear of serious repercussions because of this. So the spectrum of injuries can occur starting from the lid, that is called the ecchymosis, lid laceration, fracture of the bone around the eye, which is called the orbit, subconjunctival hemorrhage, conjunctival laceration, corneal scleral rupture, and corneal rupture, scleral rupture. All these problems in the back of the eye, like a hemorrhage inside the eye, vitreous hemorrhage, or even traumatic glaucoma, the eye pressure goes up, or optic nerve injury, or traumatic optic neuropathy, and all these occur. Even retinal detachment, open globe injury, ruptured globe. So you can see this is a very simple problem where there is a subconjunctival hemorrhage wherein there is a bleeding outside the eye. The bleeding usually clears up. You can see the what you call the blackening of the lid margin also, or around the eye. That's called the ecchymosis. This is again a fist injury which has produced a rupture of the globe. You can see the tissues inside the eye have started coming out. You can see that. And again, very, very important for us to understand this problem. So this is a very, very serious issue. It requires surgery. Just like the heart attack, you need to operate within a few hours after the surgery. And that is one of the reasons why we need to know why we need to prevent this. For example, this is a patient who had a sickle injury by a husband who was completely inebriated state. And is a sickle, and the sickle actually knife, I can see the severe laceration on the cornea. So what I'm doing is I'm going in and trying to suture that irregular cornea which is there. The cornea is completely gone. There there is a tear in the cornea, and you can see that this is one of the main this thing wherein obviously the patient, because of the corneal scar, cannot see well. But fortunately, the corneal tear is not at the center of the cornea. So what I'm doing a primary repair of the cornea, and then going ahead with the secondary surgery probably 1 or 2 months later. But the primary repair is very, very important. You can see that cornea sutures have been done. Again, another patient you can see here, the stone injury. A stone was thrown on a 6-year-old female, the daughter of a thing, because she came in the way and the stone hit the eye, and you can see the stone completely cut the cornea from the limbus to limbus, that is from the one side of the cornea to the other side. There's a vertical tear on the cornea. You can see that the whole cornea is being repaired. This child obviously will require at a later date a penetrating keratoplasty. Again, a knife injury, you can see a corneal tear again. The problem is the cornea is only the front of the eye and gets exposed. And usually, normally, when knife is brought near the eye, there is a reflex, what you call thing, wherein the eyelid closes and protects the eye. But sometimes when the knife is brought at a very rapid pace, the eyelid protection mechanism or the defense mechanism is lost, and usually the tear occurs on the cornea. You can see that corneal tear and post-corneal tear repair on the right side as well. So another patient who had a knife injury, again, a very, very badly lacerated cornea and the tissue from inside the eye coming out of the eye. Underlying cataract is also there. So I have done the corneal tear repair. I'm doing the corneal tear repair. I'm going ahead and doing the cataract surgery also in the same sitting. So again, these are all things which are very, very important. And because of the awareness which is there among the public, so it's important that they don't go to a general practitioner, report to an ophthalmologist, and there is something like a golden hour, similar to what you have in the myocardial infarction, or you can see in strokes as well. Again, a kick injury wherein the husband was completely in the alcohol, stamped on the wife's eye, and you can see that it's completely it is with the foot, and there is a rupture of the globe as well. The whole contents of inside the eye, when you have something like a very heavy force on the eye, the eyeball can completely go into two halves, and that's what has happened in this case. And we had to suture that rupture and then take care of the intraocular contents. This patient also had a detachment of the retina, which he needed to tackle later. Again, another patient, you can see a fist injury, 29-year-old fist injury because of the family dispute, property dispute, which is very, very common in a place like South Tamil Nadu, wherein, or even Uttar Pradesh, wherein there is a property dispute can occur. And the whole lens which is there inside the eye has come out of the eye, you can see here, and the lens has to be extracted from outside the eye. And this is called a phaco seal, which is very, very good. So once we remove the lens, you can see here, there is the underlying there is a large tear in the sclera. That is, the sclera is the white part of the eye. The cornea is the black part of the eye. The scleral tears are very, very dangerous because it's very difficult to close them. So I had to do a vitrectomy and close the scleral tear, and this patient also did pretty well. So what of the role of ophthalmologist? Ask questions, relevant history in the appropriate settings. Medical legal documentation is very important. Arrange for appropriate counseling or help, though females more affected, men may also be victims in this. So we have the Ocular Trauma Society of India. We have the Asia Pacific Ocular Ophthalmic Trauma Society. All these are societies which are focusing on preventing our ophthalmic trauma or the ocular trauma, or whatever we call it. Better documentation for improved statistical reporting, patient and physician awareness by trauma societies, seeking medical legal help and counseling, because these are all medical legal cases and we need to document. The next I'm going to focus on firecracker injuries. These firecracker injuries, as you know, Diwali is something which is a very major festival throughout India, and you can see the crackers are being burst. These crackers can be very, very deleterious, not only for patients who have got lung problem, but also can cause serious injuries, especially to the eye, because many of these crackers, it's like a missile and going into the eye. So 1.6 to 2% of all the ocular injuries constitute the firecracker injuries. 10% of the ocular injuries in children are firecracker injuries. Most of the injuries reported in children are under 15 years. There are firecracker injuries. 14 to 16% of the injuries, 60% injuries reported in the bystanders. That is, people who are standing near the crackers while were watching how the crackers, and you can see that they can also get affected by means of these cracker injuries. The common causes of the cracker injuries, the flower pots, the cone fountains, the most common cause of injury. The bombs, 37% of serious ocular injury, like atom bomb, rockets which can go the wrong way and hit your eye like a missile, and sparklers, and which can also cause. So all these what do you call firecrackers can cause a very serious problem. As you know, this Sivakasi is something which is a small town near Madurai, and this Sivakasi is the what you call the gold standard for the cracker industry, and maximum number of cracker in this thing it's a huge industry which is there, and from there the crackers are being produced and exported to many countries and sent throughout the country, throughout the India as well. So this Sivakasi is a very small town, and this becomes very important because there is no proper standardization of this cracker industry as well. Just like our ISO or the NABH, there's no proper standardization. Of course, to a certain extent, the quality control is being brought off late, but we do not know. The sparklers produce mainly conjunctival or the corneal aberrations. The rockets, one cone-founded bombs produce serious vision-threatening ocular injuries. Usually, what happens is the child goes near the thing because it doesn't burst, and then when it goes near, suddenly it bursts. Flower pots are not supposed to burst. Sometimes it bursts. So that is the reason why the children are taken unaware, and they are not being supervised by the adults. And that is the reason why children are very common. And some of these, every time, despite so much of awareness we give during Diwali time, before Diwali time, after Diwali time, we got pamphlets in almost every languages, but still we get a number of cases of ocular injuries which are very serious, and some of them we can't even get back the vision. And in combination, fireworks, cone fountain with bomb, uncertainty of timing of explosion is increased, as they use two separate fuse leads, thereby making them extremely dangerous. And that's the reason why we are all advocating for what do you call green crackers, or avoid the crackers totally. But there's so much as well that we are not able to do it. But we are working on that. So these are all the various problems can occur, which I told earlier for the domestic violence as well, like IFEMA, hydrodialysis. To be practically every part of the eye can be affected, starting from the lid all the way to the retina and optic nerve to the orbit, that is the bone, which can occur, the cracker injuries. This is see, you can see the cracker injuries. The cracker has actually burst into the eye, and you can see remnants of the cracker on the white part of the eye, which is there, which is seeing. Again, another patient with a ruptured globe. He's a 15-year-old boy with a cracker injury in the right eye, and you can see after the ruptured globe repair. And this is again a subconjunctival hemorrhage and chemosis following injury. Another patient, a young patient again with a traumatic cataract. You can see the iris is also torn. That's called hydrodialysis. I'm removing the cataract, and this I'm doing after about 1 month after the cataracts, after the cracker injury, and you can see that I'm using that thing to remove the cataract, the white part, that is with the white portion is which is a cataract, and then going ahead uh, and implanting a lens, which is again very important, and repairing the hydrodialysis also. So these are traumatic cataracts, which are very common. Sometimes when these cataracts can be very dangerous, because can be associated with the say various uh, problems in the front of the eye, that is called the anterior segment, and they can have secondary glaucoma, where the eye pressure can go up, and all these problems can occur. And this is the only way to do this is, of course, this patient got almost 90% of vision back. But you can see another 12-year-old boy, you can see there's a ruptured globe because a cracker injury, flower pot actually burst into the eye, The flower pot is not supposed to burst into the eye, and this is what happened. Again, another patient can see that there is again a irregular laceration of the corneal tear, and again another patient with the rocket injury, which is very, very common. The rocket, what happens is holding the rocket. Sometimes they hold the rocket and burst it, or keeping the rocket in a thing, and the rocket loses the direction and comes straight into your eye like a missile and bursts into the eye. And this is what happens when there is a blast in the eye. Again, you can see that there is a shrapnel and a cracker piece going into the eye, just lodged behind the lens in the eye. And this we need to do a surgery and remove this, and the patient did very well. Again, another patient, you can see here cracker injury, and there is also a corneal tear. There is a traumatic cataract also, and we had to go in and remove the cataract. But what surprised us was, and there was also a small piece of iron inside the lens. So we had to remove that also. You can see that there's a small piece of iron which is being removed from inside the lens, which is there caught in between inside that cataractous lens, and we had to remove that also. So all these surprises can occur on the table for us in a traumatic cataract, in a traumatic situation, and we need to have a plan A, plan B, plan C. All these can occur because of that, and we need to do that. It's not easy to do a trauma surgery because it's so very difficult, very difficult to anticipate what is going to be. It's not like a routine surgery. You can see there's a fairly big piece of iron which is there lodged inside, and obviously this patient also did very well. And you can see again another patient who had a atom bomb injury, hit the eye, atom bomb, and produced a corneal tear, but also produced a hole in the center of the retina, which is called a traumatic macular hole. And this patient also required a surgery called vitrectomy, major surgery. But unfortunately, because of the severe damage to the retina, the vision did not improve. Another patient, you can see a cracker injury. There is the entire lens is cataractus, and also not only cataractus, there is a tear in the iris. You can see that hydrodialysis is there, and also you can see that the zonules, the lens is also subluxated or to a large extent. So all these problems can occur because of the severe injury impact which is there on the eye. So I had to go in and remove that cataract and put a lens, this thing to, it's called the capsular tension ring, to support the area of the zonules which are weak, and then put a lens, and then because the pupil is also dilated, it's called traumatic mydriasis, and I had to do a pupilloplasty for this patient, and which is again, these are all things which you need to do. This is a pupilloplasty which I'm doing. You can see here, I'm bringing the pupil down, and you can see that I'm bringing the pupil down and making the pupil small because the pupils are dilated because of the injury. And we need to, unless we bring the pupil down, the patient will not be able to see. The patient will have a lot of glare in the postoperative period. And of course, the tone iris also, which is called iridodialysis, also I had to repair in this particular patient. So what are the things? Prevention is better than cure as far as firecracker injuries are concerned. Burst the crackers in open space. Avoid bursting within the household premises. Adult supervision is very, very mandatory. Always go for the best quality of crackers. Wear protective footwear. In order to maintain distance, always have a long lighting band. Wear cotton clothes. Have adequate security measures like water, sand, or fire extinguisher by the side. And can see here, do not light by keeping the face above the flower pot. Do not keep fireworks varieties near the display item. Do not hold on hand during after lighting, which happens very commonly in our country. Avoid loose clothes while enjoying the fireworks. Do not use candle or safety matches to light the flower pots. Always use a long wand. Light the fuse with the lengthy lighter sparklers with the extended arm and get away immediately. And making sure that you are under adult supervision. Making sure that you are no open space and not within this, because we have had instances wherein they burst the crackers in the bedroom, in the kitchen, and all these problems can occur. And we need to make sure that This awareness is very important because prevention is always better than cure, because it can be a very serious, grievous injury to the eye. Do not wear loose clothes. Do not hold the crackers in your hand and light. Avoid rockets and atom bombs. Do not relight an already lit cracker. Do not burst near inflammable articles. Sometimes, you can have a gas cylinder or a petrol bunk can be there next to it, or you can have a kerosene thing, and all these are very, very important. These are the statutory warnings we are trying to give, just like statutory warnings the government is giving for smoking and alcohol. We are also giving for zinc, and smoking causes cancer. Say no to tobacco. Firecracker injuries can cause serious injury to the eye, and this is what we are trying to talk to the government, and the government has also approved, and the statutory warning, the license, the protective gear, quality control, allotting open air spaces, creating awareness among the public. Because awareness is very important, not only for eye injuries, but also for other injuries as well. Because you need to wear a helmet while driving a two-wheeler, otherwise you will be in trouble. Unless you create an awareness, because you want to avoid head injuries, similar to the eye injuries also, we need to create awareness. The awareness is very, very important. Not only awareness, but also the government should enforce the law. Very, very. Firecracker injury can be very grievous, sight-threatening. Children must burst firecrackers under adult supervision only. Following the protocols is mandatory while bursting the crackers. Recognition and early treatment is very important. Prevention is always better than cure. So, pressure cooker injuries is something which is there, and which we reported long time back. And because at that time we had some defective pressure cookers, it was very common among housewives. The weight of the pressure cooker hits the eye like a bullet, and rupture of the globe is very, very common pressure cooker injuries. You can see here, these are some of the pressure cooker injuries which have been there. You can see here again another patient with a pressure cooker injury. What is a pressure cooker? Is used mainly for cooking. I'm sure everybody will be having a pressure cooker at home. Cooking dal, rice, vegetables, etc. Mainly used in the Indian kitchen. More than 60 to 70% of the Indian kitchens have some sort of pressure cookers. And you know how to use it. And this pressure cooker, you know how to use it. You can see here. See this again very important.
இது மேல இருக்கிறது வந்து
The weight is there. Weight is there.
ஸ்டீம் ரிலீஸ் பண்றது
Steam to release the thing. And
சேஃப்டி வால்வு இத பத்தி எல்லாம்
the vent there. So when the pressure goes up, the vent gets.
இது அலுமினியம் ஸ்ட்ராங் ரேட்ல நல்ல திக் மெட்டீரியல்ல யூஸ் பண்ணிருக்காங்க பாருங்க. ஏன்னா அந்த பிரஷர் தாங்கக்கூடிய அளவுக்கு இந்த பாத்திரத்துக்கு வெயிட் வேணும்.
So you need to make sure that the pressure
வெயிட்ல பாத்தீங்கன்னா பிளாஸ்டிக் கொடுத்திருக்காங்க.
Yes.
So நம்ம ஹேண்டில் பண்ணும்போது சூட நம்ம கையில தாக்காம இருக்கு. இது இந்த போர்ஷன் வந்து சேஃப்டி வால்வு. இது பிரஷர் ஏதாவது ஒரு காரணத்தால இது சோக் ஆயிடுச்சுன்னா இந்த சேஃப்டி வால்வ் ரிலீஸ் பண்றது.
The main pressure valve gets choked, the safety valve opens up.
வெயிட் இதுவுமே சேஃப்டி வால்வ்
like a venting system.
வரும்போது
So all these are very, very important.
பிரஷரை அனலைஸ். So உள்ள ஒரு குறிப்பிட்ட பிரஷரை மெயின்டைன் பண்ணிக்கும். அதான் இதோட வேலை. பிரஷர் ரெகுலேட்டர் மாதிரி. ஏதாவது சில நேரங்கள்ல நம்ம சமைக்கிற பொருளே இதுல வந்து.
So what happens is many of the times the gasket is not working properly, and because of that the
இந்த இடத்துல எங்கேயாவது வெட்டுப்பட்டு இருந்தா நீங்க இந்த புது கேஸ்கெட் போட்டாலும் இந்த குக்கர் வேலை செய்யாது. அதனால நீங்க பாத்திரம் வளர்க்கும் போது கூட இத கேர்ஃபுல்லா பண்ணுங்க. ரொம்ப அடி பிடிச்சு ஒரு மாதிரி.
The improper loading of all these are very important, because many housewives don't even know how to maintain a pressure cooker, and pressure cooker injuries can be very, very serious. We reported a serious long time overloading of the pressure cooker, defective rubber gasket. We saw that premature opening of the lid, occlusion of the valves by the food particles. You can see this again overloading, again very important. And this dal, sometimes if we don't clean it properly, the dal can actually, the dal particles and the rice particles can occlude the vent, and this can produce a problem in the main thing, and the weight can go up and hit the roof and go up like a missile and hit the eye. And that's what happens when in many of these cases. You can see here how the thing is very important. You can see the dal gets long if you don't clean it properly. And the casket is also not properly. You can see that how the pressure, when the pressure goes up, what happens is the vent, the pressure, the weight goes up. And if everything, if the vent is also long, and if you open it, try to open it, then the whole weight will go up. And it's a very heavy thing, which is like a missile, it's like a bullet. And all these things. Of the globe is a very common thing which can occur with the pressure cookers. And because it's a very common thing, every household has this. And very important that to create an awareness, we create an awareness among all the public and how this rupture go, all the, as you can see the severe bleeding inside the eye, all the structures have come out of the eye because of the hitting of the bullet, that is the weight which is there, which goes up and then comes and hits the eye like a missile, like a rocket. This is another patient who had a traumatic cataract, corneal tear, again, a traumatic cataract, again, a patient who had bleeding inside the eye. So read the instructions properly, check your kit, brown IT, liquid matters, brown it, liquid matters. Do not overfill, do not over fill the pressure cooker. Heat it right, time it, check it, release the pressure properly, and thicken it, and then clean and store very well. And make sure that you also maintain the pressure cooker. Maintenance of the pressure cooker is very important, because if you don't maintain properly and if you don't follow all these protocols, you can end up in a serious problem, and you may not even know that it is going to happen. So can be very serious, sight threatening, similar to the blast injuries. All the protocols regarding the usage of pressure cooker have to be followed strictly. Prevention is better than cure, as I told you. Chemical injuries can occur. This is a patient who had an acid injury. You can see that acid is being thrown because of some family dispute. And again, another patient who had a young fellow from the paint fell into the eye. You know, the paint is something which is called alkali. The alkalis are more dangerous than the acid, because alkalis penetrate and go into the eye. And this is again patient who had a preoperative, that is the alkali injury. You can see the cornea has completely become white. The cornea is normally transparent. And because of the Sunambu injury, that is the alkali injury, and after the corneal transplant surgery, the patient regained almost about 90% vision. Again, another patient with acid injury, you can see here on the left side, on the right side, you can see after a corneal transplant surgery or penetrating keratoplasty, you're getting fairly good vision. So many of these chemical injuries, what happens is, it is not only enough that you do a corneal transplant, but because there is a limbal stem cell deficiency, or what we call as LSCD, that around the cornea, there are limbal stem cells which are responsible for the vasculature or the blood supply to the cornea and to the surrounding areas, and the nourishment of the cornea. And you can have unless you replace them, and by means of the cultivated limbal epithelial transplant, or CLET, and which we are doing regularly. Again, you can see here one patient with a chemical injury on the left side and the acid injury, how the cornea has completely become white, and there is also LSCD, limbal stem cell deficiency. And after the partial corneal replacement or lamellar corneal transplant surgery, which is called LK, lamellar keratoplasty, and along with the cultivated limbal epithelial transplant, the patient regained fairly good vision, and the corneal clarity is also going to come back. This again, a 3-year-old child with the chunambu. As you know, chunambu is a very, very important thing which is available in the packets, more common in North India, which contains lime, the chunambu. This contains a very, very serious problem, and the chunambu packet can open up. Sometimes you open up the packet, it will burst on the eye like this. And this child also had a similar thing, the chunambu injury, and we can see that stage by stage we have revived the ocular surface, and by after 1 month we did we can see that the central epithelial defect, and that is called the alloslit simple limbal epithelial transplant, wherein we take the limbal epithelial cells from the surrounding, from the alloslit, followed by the slit. Allow slit means we take it from the contralateral eye, and the slit we take it from the auto slit means we take it from the contralateral eye. Allow slit we take it from the dead cadaveric eye, and all these can also be done, which has been popularized by our own Indian Virendra Sangwan. This is one to just to show you how the slit is being done. You can see this is a patient had a acid injury, and the cornea has completely become opacified, the cornea become white. So we take the epithelial cells from the eye, which is a normal eye, and then remove the you can see that these are the limbal epithelial cells from the eye, which is not affected, and this is called the yeah, and then put it on the cornea. You can see this, the cornea is completely damaged because of the acid injury. Remove the pannus, that is the surface of the cornea, and you can see here, and this so, the pannus which is there on the surface of the cornea, and we remove it, and then we go ahead and do the amniotic membrane transplant, and yeah, I can put we put an amniotic membrane, and on top of that we keep these epithelial limbal cells. So this is called the SLET, simple limbal epithelial transplantation, which is become very, very popular and with effective results. Again, these are the limbal epithelial cells which are capable of transforming into regular cells and revitalizing this cornea. And this is a SLET mechanism which is used for all the chemical injuries, whether it's alkali or acid injury, which gives excellent results. So this again another patient is once we have done with the cuisine, then we have a huge group of conditions which are called the sports injuries while playing cricket or tennis or badminton, shuttlecock, and these are all injuries which have come up because, as you know, big cricketers like Sabah Karim, they have lost the eye by wicket keeping, or even Mark Boucher, they have lost the eye, and many of these people have occurred. So now I'm going to talk about some giant intraocular foreign bodies because of the injury. So this is just to show you how one patient is trying to pluck a drumstick from the thing, and he had a traumatic cataract, corneal tear, and there was a large drumstick which has gone inside the eye. This is a retained intraocular foreign body. So yes, and he had an infection also, which is called traumatic endophthalmitis. You can see the retained intraocular foreign body. We never expected this to be so big. So we removed the cataract. We repaired the cornea, removed the cataract, and we found something like this on the cornea, in the eye, the front of the eye, which is in the anterior chamber. And then we tried to remove it, and we found out that it is a huge, what do you call, the drumstick. The drumstick as you know, is a vegetable which is very commonly used in our country, and it is used for making sambar, and it is one of the rich sources of vitamins and minerals. And you can see this is one of the large intraocular foreign bodies. We reported way back in 2008 this patient, and in the American Academy of Ophthalmology, and we got the award also for this particular thing. And this is one of the largest intraocular foreign bodies reported at that point of time, which is about 20 millimeter. The size of the eye itself is only about 20 to 23 millimeter, and this was about 20 millimeter in size. You can see that. But many of these patients were given up before, but nowadays we are able to do this. You can see here this huge foreign body which is there, which is nothing but the drumstick. We had the tip of the drumstick which has gone into the eye. And this patient, had to do a marathon 3-hour surgery, and and they did pretty well. He did pretty well also. How this drumstick fell into the eye? You can see here. I'm going to show you an animation. How this drumstick. This is the end of the surgery, and yeah. As in, this is the first week post-operative. The patient is still following up with me, and is having fairly good vision, about 60-70% vision with him even after about 14-15 years of surgery. The drumstick is grown in the trees, and it is also, as I told you, used in sambar, more commonly used in South India than North India. Harvesting drumstick can be dangerous. He tried to harvest the drumstick. You can see how the drumstick, while he was harvesting, straight away went into the eye like a missile and got lodged there. So this is another patient. You can see a 35-year-old male, a laboratory worker, injury with a vernier caliper. He was using a vernier caliper like a chisel, and preoperative vision was only 1/60, very poor. There was a limbus to limbus corneal tear, traumatic cataract, retained intraocular foreign body. And this is what he did. He's a laboratory worker. He was using wanted to chisel something, and he was using this vernier caliper, as you know, and using that hammer and chisel just like the carpenter. And this caliper got broken and went into the eye like a missile. You can see that I removed the lens. I went in and did a surgery called a vitrectomy and removed that caliper. You can see a large piece of the caliper which is there inside the eye. And these are all patients whom, as I told you, we never used to venture into this surgery. But nowadays we are operating this because we've got our advanced sophisticated technology with us, techniques with us, and we have understood this. So you can see how big it is. It's almost 11 millimeter at the size of this caliper, and which is there, and we brought it through the cornea, and then I can see that 11 millimeter in size, and replace the cornea. Patient also had an underlying detachment, and the patient recovered almost about 40-50% vision after the surgery. Again, another patient with the 24 years male railway engineer, globe rupture, traumatic cataract, total ifema. He was working on the track, and while using, and he had a small injury, and a large iron piece had gone into the eye. You can see that I had to remove the lens, sacrifice the lens, because the size of the foreign body is quite big in this case, and these are all giant intraocular foreign bodies. And these, with the marathon surgery, we were able to combine everything, both anterior and posterior segment surgeries, and attaching the retina also in the same sitting. We're able to get good results in this case. You can see the size of the foreign body. It's almost about 8 millimeter, and you can see that this patient also did pretty well. So again, another quarry worker, you can see her while working in the quarry is only one eye of the other eye already lost because of the previous injury, and there is a stone in the front of the eye that is called the anterior chamber, and I had to remove stone. There is also corneal opacity, and the patient did very well after the surgery. Another patient with a metal piece, and this is again a factory worker. So many of these factory workers, they don't have any protective glasses they're supposed to wear. The factory workers, the employees also don't insist on that. That is the biggest problem because we don't enforce the law. So in this patient, we had to remove the piece which has gone inside the eye. The take-home messages are: size of the intraocular foreign body does not matter. Early radical surgery and removal of the foreign body gives very good results. Proper surgical techniques gives excellent gratifying results in all these patients. Thank you, IJCP, for the wonderful opportunity and the patient attention of all the delegates. And because this was something which I wanted to create an awareness among all the people about this ocular trauma. This ocular trauma is something which is very, very important. Just like the heart attacks, the brain strokes, the ocular trauma also, there is a golden hour. The first few hours is a very, very important because you need to report to the patient, to the ophthalmologist, and the ophthalmologist has to take an immediate decision whether to operate or not. And we have operated in the middle of the night also, so as to get good vision for these patients. So, the message is that many of these traumas, as I told you, whether it's a sports injury, prevention is better than cure. And all the industry workers, all the workers, carpenters, the welders, they should all wear protective goggles. Very, very important for you to understand this. Very, very important. While playing also, it's very important that contact sports, that you should avoid this to a large extent. And don't try to give some homemade treatment, and don't try to give put some drops immediately as soon as you have, whether it's a trauma, it's a major trauma or a minor trauma. immediately consult an ophthalmologist. There's a huge network of ophthalmologists in our country. There are more than 35,000, 40,000 ophthalmologists covering every length and breadth of our country, every nook and corner of the country. And all of them are very good. All be able to take care of the ocular trauma. We in Rajanekar, we have a 24/7, 365 ocular trauma clinic which takes care, which caters to all these, especially during the Diwali time, because we get a huge number of patients because of that, and also during the Pongal time because of the Jallikattu, which is there, a very common sport, the bull gore injuries we get also during the Shankrati time also. So again, I would like to thank the IJCP. It's always a pleasure to be here, associated with them and do these webinars. I'll stop sharing the screen now. Is it okay?
Yes, sir. Thank you so much, sir. Thank you for your wonderful talk and for such a nice presentation in such an elaborative manner. The topic, the way you have explained it for our viewers and for making them understand about it. Thank you so much for that, sir. So with this, we
Thank
will
you
be
very much.
moving to our question answers round, and we have received few questions from our participants. So with all your due permission, I would like to put across those questions to you. So
Yes.
the question is, how are some valuable clinical pearls for what are some valuable clinical pearls for diagnosing and managing ocular trauma effectively?
Clinical pearls are very important. That is, if the ocular trauma, you need to go in to the history very carefully. So, what type of ocular trauma has occurred, when it has occurred, whether it's a blunt trauma or a penetrating trauma. So, whether any intraocular foreign body has gone inside the eye, and the history is very, very important. And also examination of the patient without even without touching the eye is also very, very important, because if you sometimes there can be a ruptured globe, and touching the eye itself can produce more damage than what you can imagine. So these are all the clinical thing, and you should have a high index of suspicion for patients. For example, when the patients come with the mild with the repeated injuries, always think of some domestic violence, as I told you. So this high index of suspicion you should have, especially in ocular trauma. Please understand this: many of these ocular traumas are all medico-legal cases, and you should know how to handle these medico-legal cases. And because you'll be put up in the court later for this thing. And again, the medical legal documentation is very important. Documenting these patients very important. Documenting the vision, document the findings, and that is why we have the EMR with us. That is the electronic medical software is there. The recording is there, and the software is there for you to. There are software for specifically apps, especially for ocular trauma or ophthalmic trauma. So you need to fill up these blanks in this and make sure the documentation is very, very important.
Thank you so much, sir. Thank you for answering that question. We'll move to the next question, and the next question is related to some key strategies. So, what are the key strategies for preventing ocular trauma, particularly in high-risk populations?
Yeah, high risk population, as I told you, these people are working in the industry, the welders, the carpenters, and people who are sports players regularly. So the key strategies is to create an awareness among them, and tell them what are the how we can prevent. For example, the industry workers and all, they should have protective goggles. Many of them have the protective goggles, they don't wear them, and there is no supervision. That is the problem. So, and also for the children who, because many of these ocular trauma can occur at home, and because of negligence of the parents as well, the parents have to be counseled accordingly how to take care of their children. For example, we had a child who had a acid into the face, and the thing, because the acid was kept in the bottle which contained the soap in the wash basin. So they removed the soap and put the acid to clean the bathroom in that thing, and the child by mistake and put the acid on the face, and it went into the eye. So all this negligence of the parents also. The parents also should know the child should not use this, and also the all these acid, alkali, all these chemicals should be out of reach for the children. So these are all key strategies. The only thing is awareness, as I told you, is very, very important. The awareness, especially in ocular trauma, just like you take care of the diabetic retinopathy by taking care of diabetes, hypertension, your cholesterol, and other things. The awareness here is to making sure that anything in the house can cause. For example, a compass, the geometry box the children are working with. Sometimes they play with the compass. The compass can go into the eye. We had some patients. I also had some thing I forgot to show that compass injuries are very, 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 very common among the children. And so the counseling starts. For example, workers, we need to give priority goggles, and for sports people also, we can give priority goggles to a certain extent. But for the children, to avoid the children, of course, apart from educating the children in the schools, but also educating the parents and the teachers, and how important it is to prevent ocular trauma, and how important it is to identify this ocular trauma and bring it, because many times they come a little late. They come after 1 or 2 days thinking that it's not a very serious issue, and then come a little late, and by the time the damage is already been done. So awareness is very important, and that is what we are trying to do through the Ocular Trauma Society of India, as well as the Asia Pacific Ophthalmic Trauma Society.
Thank you so much, sir. Thank you for answering that question. Moving to the next question, and the next question is related to your experience. So, can you share any interesting or challenging case of ocular trauma that you have encountered in your practice, sir?
That's what I told, no? That the drumstick,
Yes.
the drumstick which I showed that. I think this is a very, very, very nice patient. He just plugged the drumstick, and the first time uh, when I presented this in the American Academy, because there is no drumstick vegetable there in the US, and they were all very surprised. And they were asking whether it's a drumstick which is used for the musical drums. Then I had to explain to them. I had to show that the sambar gravy, that the drumstick is used as a vegetable here, and it is a rich source of vitamins and minerals. And this drumstick, and they were all very surprised when they saw that a drumstick out of the eye, coming out of the eye, and then I told them that that the result also of the even after the vision is also very good. Almost 70-80% the patient regained the vision, and so it's something which is the patient is still following with me, and the patient is so happy that like this we have got many big huge foreign bodies. The other one is a vernier caliper, which I showed, and these are all foreign bodies which are removed from the eye. And actually, it makes a huge difference. And especially for these workers who are there in the industry, we had another patient recently wherein while what do you call uh, downloading all the what do you call the granite tiles from the lorry. The granite tile, one of the granite tiles slipped and went into the eye, and it chipped and went and it ruptured the globe. And I almost gave up. It's because about 20 years, 30 years back, we used to remove these eyes for the fear of because if you don't remove these eyes, there's a condition called sympathetic ophthalmia, which can occur which can affect the normal eye, which is not injured. So, but nowadays we rupture globe also. We think this patient, I told him I will operate on you, but I will not give even 1% guarantee for you. He said, I have a lot of hopes on you, doctor. You can operate on me. So like that, I have done this rupture globe, and the patient had fairly 30-40% vision after the surgery, which is very, very good. So the second stage we had to do sometimes in 2 or 3 stages, and no, we can't give up. Yeah, see, the ocular trauma is the only condition wherein even the patient cannot have any perception of light, that he will not be able to see any light perception, before the surgery, but still we can go ahead and operate on them, and we'll be able to get something out of it. So never give up on this, patients. That's what I've done in the past almost 3 decades of my practice.
Thank you so much, sir. Thank you for sharing your expertise and for sharing such valuable information with us and helping our viewers and understanding them, and so that they can also implement it in their expertise, in their practice field. So thank you so much for that, sir. And this was the last question for today. And with this, I would like to thank all our viewers for their ardent participation that they have shown by staying tuned with us and by putting across such interesting questions to us throughout. Thank you so much to all of you. And I would like to thank you, sir, for taking out your valuable time and for being here as our platform and sharing these insights with us and your experience with us. Thank you so much, sir.
It's a pleasure to be here as part of the IGCP. It's always a pleasure, and I never say no to Ankana and the entire team, and because though I was in Dubai, from Dubai I connected from here, and it's always a pleasure. And I hope this ocular trauma will create an awareness among everybody, and so that we can prevent ocular trauma in the future and prevent major calamities to the vision threatened. Thank you.
Thank you so much, sir. Thank you. With this, we are